MCI is a syndrome, and it's important to begin with that we find out what is causing this syndrome. And there are many things that can cause mild cognitive impairment, including neurodegenerative dementia disorders such as Alzheimer's disease or frontotemporal dementia or Lewy body dementia. And it has implications, ethical and practical, for patients to be diagnosed very early on in the MCI stage with these dementia disorders that we can't really cure. We can't offer much in terms of treatment. We can manage the symptoms of the disease and the diseases, but we can't cure them. So it's important to make people realize that if we proceed with the diagnostic evaluations, we might actually find out that they have these very serious diseases in an early stage. And of course this may be very relevant to the management of these patients, but it might also give the patients knowledge that can be difficult for them to handle or that they really don't want to have. So we need to engage in a discussion with these patients before we do biomarker sampling and other diagnostic evaluations. It's of course important that we don't regress to a more nihilistic approach to these patients as well. MCI might be caused by conditions that we can actually treat, like, for example, cerebral tumors or vitamin deficiencies or depression or things like that. So that shouldn't stop us from trying to find out what these patients actually have in terms of the underlying disease causing the syndrome of MCI. But we just have to be careful, especially when we go to the diagnostic tools that enable us to diagnose these neurodegenerative disorders very early on.